to film my walk because I had to go with my dad to the hospital in Groningen. So I did do a walk, but I did not have time to make my vlog there. So I'm doing a vlog now. So today is day 5 of the HS Awareness Week. And my topic today is hope for HS. And hope is in the studies that are currently being done. The studies that will come. They need to find a cause. This is one of the main things which is very important. And they also need to find better medicine, better treatment without as many side effects as there are now. So now we have treatments like biologicals, loads of antibiotics, all those kinds of things. Those have side effects, those have risks of being antibiotic resistant, and we don't want that. So especially for a chronic disease, we need a type of treatments that we can use chronically, but that don't have many side effects and many risks. So me personally, I found that in phage therapy. And phage therapy, in my opinion, should be the future for HS treatments as long as we don't have a cure yet. The power of phage therapy is that bacterial phages have the ability to not only kill bacteria, which can be a secondary problem with HS, but also modulate the pathway of our immune system that creates inflammatory reactions and modulate them to have a less severe reaction to what's going on in our body, to the cause that we don't know yet. And for me this works really well. I know many other HS patients who use bacterial phages and phage therapy, and they also have amazing effects. But this treatment now is out of pocket and it costs a lot of money and not everybody is able to afford it. But there's loads of hope in this treatment, in my opinion, and not only my opinion but also in the opinion of many scientists and doctors. And by creating awareness and showing the world that this is not a rare disease, that there's not many forms of treatment yet, and that we need a treatment like this that we can use chronically and that might help loads of HS patients, it's very important that we show the pharmaceutical companies that we need a treatment like phage therapy. And we do that by creating groups, by creating awareness, putting up surveys, and asking our doctors over and over and over again about phage therapy. So there's loads of promising things for HS, and there's lots of hope, but we need more research, and this is where our hope lays. And this is also my goal with the awareness, to create awareness about this disease so more people get the right diagnosis, to encourage people to go to the doctor and ask about treatments like phage therapy, because the more doctors that hear about it, the more doctors that have a buzz about this treatment, the more hope there will be that there will be clinical trials, and then soon it will be available for more patients. So for me, this is where my hope lays. For me, it already works. I don't need the research anymore because I found a way via crowdfunding to fund my treatment. But for all the others who can't, I am working my ass off to give them more hope and to get this treatment at least visible at all the conferences, visible at all the patient alliances, because there's definitely hope in this treatment. And there are many other treatments and other options that are being studied right now that can have hope for HS. And that includes many different kinds of biologicals. For some people that works. But I'm trying to find a way that is less invasive and has less risks. And for me, phage therapy worked really well for that. So for me, that hope lays there. And I hope I can bring it to more HS patients all over the world. Somehow, one way or the other, I would try to kick in every door there is, make everybody who has something to do with phages and HS listen, see the stories, see the result pictures that many HS patients who use phages have, and put this on the agenda of HS conferences and skin conferences, because there is really a treatment out there like this that helps without many side effects and without many risks. And it should not help for everybody, because everybody's different and none of the treatments out there work for everybody, but it could work for a lot of people. So there's always hope, and everybody can contribute to that hope by, as soon as you find something that works, study it. I studied phages for 2 years before I decided to go do the treatment, to raise money for the treatment. Talk to everybody you know, create a buzz, because that helps. And there's always hope. Hope for HS, hope for the patients. And don't give up, ever. Always keep on hoping. And this is my message for today. So wishing you all a lovely day, and hope to see you guys tomorrow in my next vlog. Bye guys!